Okay, hi everyone. My name is Will Fowler. I am the Associate State Director for Operations for the Idaho Small Business Development Center. Thank you for joining our webinar. I apologize we're starting a few minutes late. I believe there was an issue with the link for people registering, so I think we'll probably see some folks join us a little bit late as we go on. But we're going to start now because we've got some great content and experts we want to get to and give them lots of time to chat with all of you. So. The first thing to know is this is the webinar is Ask the Experts, the new normal for Idaho businesses. We're going to have a lot of time to talk to some very fantastic people today. We have John Ashby, who's an HR attorney and partner at Holly Troxel. We have Jared Oviatt, who's from BBSI, which is a professional employment company. So he's a specialist in HR staffing and operations, many things related to having employees. We have Natasha Fernie, who's from the Southwest Public Health Office. And we also believe we'll have David Kearns joining us in a little bit, who's from OSHA. So we've got some fantastic content. And this is all going to be led by Ruth Schwartz, who is an SBDC consultant out of our Boise office, who is an expert in all things COVID-19 related to business. So she's been our subject matter expert in many of our webinars. And for anybody who's attended one, she is a familiar face to all of you. So we're very happy to have her guiding us through and asking a lot of the questions. What we're going to do is we'll have the first half or so of the webinar be Ruth talking to our experts, and then we will open it up for Q&A in the second half. So to do that, open up the Q&A box, which is if you look at the bottom of your Zoom screen, there's a Q&A button. If you open that, you can ask your questions and see other questions that are being asked and answered. And also you can open up your chat box. So there is a chat button at the bottom as well. If you want to talk to the other attendees, that's the best way to do it, is through that chat function. And we'll be following along. You might see some chat messages from Margaret Bushy at the SBDC. We'll be following along and giving some key points via chat as well. So the way to get the most out of this webinar is to open up the Q&A so you can ask your questions. Also open up the chat so you can get some key points and chat with those who are also attending. So without further ado, I'm going to stop sharing my screen and kick it over to Ruth, who's going to get into the real important stuff. So go ahead, Ruth.
Thanks, Will, and thanks for everybody for taking some time and to learn from how many great people we've got on this call today to learn from. And yes, we do have a full complement. David Kearns is on the call, and maybe Will didn't notice that, but thank you all for being here. I'm going to load up what I think are some of the critical questions. Just to get you warmed up. This is for all the participants on this call. This is an Ask the Experts webinar. It is your opportunity to get your burning questions answered about how to open your business in Idaho right now. There's a lot of, there's just so many different things to be paying attention to, and we know everybody's going about doing this right now. So let's make sure we're doing it correct. I want to start out first with Natasha Fernie, who represents Southwest Public Health. Let's talk about health first. Thank you for being here, Natasha. Can you give us just a couple seconds on your role at Southwest Public Health? And then tell us what you think are the three most important things that small business owners need to be paying attention to right now in terms of keeping themselves, their employees, and their customers healthy.
Yes, sure. Good afternoon, Ruth. Good afternoon, everyone. Just a small correction before I answer your question. I am actually with the Central District Health, District 4. Yes, I'm a program manager here, responsible for several regulatory programs, food safety, childcare, health and safety inspections, and pool safety inspections. So that's my role here at Central District Health. To answer your question, Ruth, I would say that to ensure healthy workplace, business should closely follow CDC and state guidelines and recommendations for COVID-19 workplace safety. It is very important to stay in tune with the latest information regarding COVID-19 transmission and response in your area. some important resources that you may want to consult would be CDC guidance for business and employers, CDC cleaning and disinfection recommendations, guidelines for businesses that are posted on Idaho Rebound's site and your local health department's website. OSHA also offers a number of excellent resources. So communicate with your employees and educate them about how they can reduce transmission, and also establish a comprehensive plan on how you're going to respond to positive case of COVID-19 in your business, and how you're going to implement social distancing and other safety measures to ensure safety of your employees and patrons.
Is there any kind of oversight for employers, business owners, in terms of how clean is clean? We know that 6 feet is the distancing, but many employers want to know, what if I cannot create that kind of distance, and how clean is clean?
Mm-hmm. Well, to ensure proper cleaning and disinfecting during this COVID-19 response times, what employers can do, they can turn to CDC's guidelines for cleaning and disinfection. This is number one and the most comprehensive source that you can, that is available for them to use at this time. Based on the CDC guidelines, you can establish your own protocols and procedures for cleaning and sanitizing. And then train your employees on your protocols, instruct them on how to properly clean and sanitize. Evaluate your facility, evaluate the areas, and figure out what are going to be frequently touched areas and surfaces for you to focus your protocols and procedures on. Also, you can inform the public on what you're doing currently to clean and sanitize properly your facility, your business. This can be done by posting informational flyers. This can be done via social media, via your website, and so on. Yeah, make sure that the products that you use are EPA registered products. It actually came up with the products that are effective against COVID-19. Closely follow manufacturers' instructions, because some of these disinfecting agents, different disinfecting agents have different contact times with surfaces. So this is the factor that needs to be taken into account when you choose your product. So closely follow manufacturers' instructions. Also, if EPA registered products are not available, you can use a bleach solution or alcohol solutions, and those would do the job if you properly mix them. So only with bleach solution, for example, you need to be very careful and not to mix that with other cleaners and disinfectants, as this can produce fumes that can be harmful to you or your employees.
Thank you very much, Natasha. The format of this webinar, for those of you who are continuing to join us, is I'm only going to ask a couple questions of each panelist, and then I'm going to open this for you to ask your burning questions for these very impressive experts in their area. So the Q&A box is where you can do that. You can do that now if you have any questions that are on your mind. And I'm going to continue by making a segue over to David Kearns from OSHA. Can you tell us a little bit about your role with OSHA, and then tell us the three things you think are the most important items that employers and employees need to be paying attention to right now?
Thanks, Ruth. That's a good question. As Natasha, well, basically regarding OSHA, first off, I am the area director, and we cover workplace safety and health for pretty much every worker, private sector worker in the entire state of Idaho. Our role has been a little bit different during this COVID crisis. We are still conducting enforcement. However, a lot of what OSHA is doing is providing a lot of outreach and guidance information, similar to what Natasha mentioned that is out there from CDC. I'm going to be reiterating a lot of what Natasha said, but maybe I can kind of put it in my own little perspective. Again, you know, what workers and employers should be doing regarding protecting themselves is to follow the guidance that's out there. OSHA and CDC both have a lot of great information on their webpage. Rebound Idaho even has some protocols to help folks be able to follow to be successful, to do the right thing to protect their workers and their customers. But if I were to boil it down to three things, and I like to have things in nice short sound bites, I would say isolation, separation, and hygiene. And I think anybody that's been paying much attention to the news lately and following any of this is going to see that there's really no surprise here. Isolation has to do with keeping the sick at home. If you've got workers that could be ill, don't bring them back to work. Take what reasonable care you can to try to prevent other folks that are ill from being in your workplace. Now, if you're a hospital, that's a little different challenge. Physical separation, that's a little bit different than the isolation. This is for the people that may be carrying the COVID or coronavirus, but may not be showing the symptoms. So that's where a lot of the precautions to try to keep people a distance from each other, you know, whether that's using telework barriers, other measures to potentially prevent expelling and picking up potentially infectious aerosols. And then the last one, again, hand in hand with what Natasha said, has to do with hygiene. And that's the thing we've been hearing all along here. Your hand washing, surface cleaning, cough etiquette, using care, putting on and taking off your face coverings, and then using respiratory and other personal protective equipment. And this also includes limiting sharing of equipment, desks, phones, things like that to the extent possible.
I think for a lot of employers, and I'm just going to turn this around for a second. If I'm an employee and I am feeling uncomfortable in a workplace with whatever protocol that an employer has put in place, do I have recourse through OSHA?
You do. That's a very good question. We've been getting a lot of phone calls, maybe not as many as our counterparts in New York City, but we get a lot of inquiries, a lot of complaints, a lot of concerns about what steps have been taken. What we are primarily doing for the lower and medium risk categories is we're doing inquiries with employers. What we will do is if we get a call with some concerns, we have been addressing these directly with employers anonymously. So anybody that makes a complaint or expresses their concerns to us are kept anonymous. But we contact with the employer with what our concerns are, what the allegations are. We provide them a whole lot of connections to compliance assistance sorts of materials to help them learn to do what they're supposed to be doing. And then we give them a period of time to ask them to respond back to us, to say, all right, these are the steps we have been taking, or these are the steps we're planning on taking moving forward as a business. And 99 times out of 100, I say that here in Idaho, I'm sure it's been different elsewhere across the country. The steps, you know, once we've worked out and reached out to those employers has been sufficient, and we're able to wrap those up and again, just providing guidance and information as much as possible to those employers. Now, if we end up getting a complaint or an allegation about people in healthcare settings in the high or very high risk, where they are doing intubations, doing other procedures on known or suspected COVID patients, and they're not receiving protections, those are the ones we're going to be kicking up, and we're going to be going out, and we're going to be actually probably doing some on-site visits and enforcement inspections with those employers. Fortunately, here in Idaho, everything has been handled through more of the investigative process and And everybody we've dealt with has been very responsive.
As an employer, am I required to provide PPE? Am I required to meet a regular standard as far as OSHA is concerned?
Well, the simple answer is yes. If personal protective equipment is necessary to protect workers from hazards. And our rules, this is not a new rule, this has been around for a long time, whether it be protecting people from overhead hazards, respiratory hazards, chemical exposures, eye hazards, anything like that. Personal protective equipment is a broad category. And as a safety and health geek, I'm kind of happy now that PPE is in a broad vernacular now, because before COVID, you say PPE and nobody knew what it was. Now it's pretty well known. So employers are required to assess the work environment to determine if PPE is necessary to protect the health and safety of the workers. And then if it is necessary, the employer is required to provide it. Most of the time that means pay for it. Train the workers on the use and limitations. And then, and this can be the hard part, require workers to wear the PPE. It's not an option. They have to wear it if it's necessary, and it's the employer's obligation to make sure that they are wearing it. Now, the challenge in this situation with COVID, this is not like dealing with an asbestos job or methyl ethyl death, is really to determine when the PPE is necessary. And OSHA's webpage has enforcement policy and guidance. It can really help an employer assess their level of risk. A lot of this is based upon CDC. A lot of these use a pyramid that kind of has from the low to medium to the high and very high risk. And most of these high and very high risk, again, are like the ones we talk about, people in the healthcare settings. So in those cases, it's obvious, you know, significant personal protective equipment is required. The more challenging ones are these situations that are the low to the medium risk categories. You're working at a clerk at Walmart. Do we have to provide respirators for people like that? Those are more difficult to kind of be addressed on a case-by-case basis. But again, I point you to our webpage for kind of trying to sort through the different levels of risk and what's appropriate there.
I would imagine even lower risk in office spaces where there's no public coming in. Are you finding that there are uncomfortable employees who are reaching out to OSHA?
Yeah, we're finding uncomfortable employees from everything from meat packing to retail to you know, just working in a general office setting. And again, in those situations, for us to be able to come in and say, yes, you have to put on an N95 respirator in those cases, especially knowing the shortages for those who really need the N95 respirators or other respiratory protection. Those are not situations where OSHA is going to be coming in and saying this is what we need to do, but we are going to be asking what sorts of, forgive me for using a legal term when we've got lawyers on the phone, I'll let them cover this, but exercising due diligence or reasonable care to identify what sorts of situations they're dealing with and what is, based upon the most current and up-to-date information, appropriate to be using. And this is, I admit, this is tough, because we've seen in the last 3 months a very novel situation with a lot of evolution, a lot of new data coming out all the time. Do we wear face masks? Do we not wear face masks? And as Natasha said, you know, we're almost always going to be pointing people back to what is the most current and up-to-date guidance based upon what's available out there.
Okay, thank you very much. It's fascinating, actually. I have even more questions myself, but I want to push on now and encourage people, if you have questions, right? So far, we've touched on some public health issues, some compliance with occupational health and safety. And now I want to move on to a slightly different topic with Jared Oviatt, who's a part of BBMI. I think I got that backwards.
BBSI.
BBSI, good.
That's
Too many acronyms for me today. I apologize. You are a professional employment organization, and why don't you tell a little bit about what you do and what you think are the most important 3 items that business owners should be paying attention to right now?
Yeah, thanks. BBSI, like a lot of other PEOs or professional employment organizations, we provide a lot of support, both tactically and strategically, to the small business communities. And so in addition to the things like payroll processing, we also do strategic support with HR. And so we've really immersed ourselves in terms of what does the employer and employee experience look like in terms of this COVID, managing through it and preparing your business place to get back into action. And really, it boils down to just building on what Natasha and David have said. Our counsel is really, it starts with your first constituency, which is your employees. And making sure that they're not only safe and you're compliant as a business with the guidelines from the CDC and the state health and OSHA, but that you're also concerned about their emotional welfare as well. So that begins with being open in your communication in terms of what steps you are going to take in your plan to reopen the business and to keep them safe, because they need the confidence that they are coming to a place that are taking every necessary precaution to protect their health and well-being, so that they can be confident when they relate to your clientele, whether that be in a professional setting, a retail setting, services, or food service. Your staff needs to be comfortable and confident that they are not going to get exposed, if possible, or minimize the chance of exposure in the workplace, first and foremost. Part of that peace of mind is just frequent communication. You may have a plan that you've either had to register with the state health department, or you have a reopening plan that you just want to make sure that you implement so that you are providing a safe space. And you roll that out to your team, but just doing it once really isn't sufficient, because they go home and spend time with family members or on social media or the news, and there's a lot of conflicting messages of extremes. And so being able to provide a confident, clear message to your team about what you're doing to remain safe is really critical for helping these people feel like they can show up 100% every day and take care of your clients. So really, it's making sure that you know who you're serving first, which are your employees. The second is frequent communication, specifically about the plan and why you're putting specific measures into place. I know the OSHA is there as a resource, but David and his team probably have a lot more critical things necessary to support compliance than talking some people off the ledge, and being proactive in making sure that you're communicating what steps you are taking and making sure that your team is comfortable with that goes a long way to really help both minimize the risk and also minimize the anxiety that's associated with this pandemic that we've been experiencing. And I think the last thing really is make sure that if you can, we talked originally about taking extreme precautions at the beginning of this. We felt we wouldn't feel bad if we took more precautions versus didn't take enough precautions. The same thing applies with our employees in terms of communication. You can't over communicate, you can't over check in, you can't over reinforce the processes and procedures that keep them safe. That should just become part of what you do to provide a really safe and empowering culture for your employees.
All right, so I just want to make sure that everybody knows that as a PEO, you're also very heavily involved in payroll and benefits. And in terms of all the different programs that are going on, such as PPP, such as unemployment insurance, a lot of people leaning on disability insurance and workers' compensation insurance, cash grant programs, and all the federal, the IRS programs, the other Department of Labor programs, such as the Employee Retention Credit and sick leave time. What would you say is the number one question that people are asking about with you on the benefit side? Because I want to make sure that if anybody on this call has questions on that benefit call, that they get an opportunity to ask you about those.
Sure.
What do you think is the number one question? Yeah.
Number one question right now is really, what do I do about forgiveness on this PPP thing? There's a lot of wonderful things. You know, if you're eligible for a state grant through the Idaho Rebalance, we always say you go for the grant first because there are no strings attached. It is a grant. And so you get that. And there are even some regional grants that are sponsored by some of the larger employers in the state, and that they're making resources available. So we always tell you to look for the grants first. But everybody really goes to, what do I do now to make sure that I can get maximum forgiveness on the PPP assistance? Because that does come with strings attached. A couple of things to note, and John might weigh in on this as well. One thing is that the Congress and the SBA are continuing to issue guidance around forgiveness, and they may even throw the rules out and rewrite the rules in terms of making it even more liberal. What we have counseled is two things. First and foremost is make sure that you have really clear communication with your lender, because the Treasury Department and the SBA have empowered the lending institution to determine forgiveness, either in full, in part, or to reject. Because the administrative overhead on the 10+ million loans that have been extended so far is too much for either the SBA or the Treasury to deal with. So just because you spoke with your lender when you got the loan doesn't mean you're good to go. We'd like you to keep in contact with your lender as time goes on. They almost all have a designated PPP expert that is navigating these changing waters to help you go through that. The second thing is document. And I know that small business owners in particular, they hate that. It's kind of the bane of their existence, but it keeps you out of a lot of trouble in terms of compliance, whether it's with OSHA regulated spaces, legal regulated spaces that John and his team would have to get involved in. But real simply with PPP, document your expenses, document your payroll, and then document any communication that you have in terms of an employee either returning to work, refusing to return to work, or being concerned about returning to work. Because there are specific forgiveness hurdles related to the hours that people work, the number of people that work, and their opportunities to return to work. It also gets you in a little bit of jeopardy in that there's some wonderful resources in terms of unemployment for people who have been out of work. And for some of those individuals with the $600 additional federal funding, sometimes it's more attractive not to work than to work. However, one of the requirements which was thrown into the forgiveness was that it requires every employer who has received a PPP loan to report to the state within 30 days any employee who refuses to return to work at their previous wage level and the previous hours. And that was not their case in the past. But now it turns every employer into an unemployment watchdog. So that's kind of a frustrating piece, but on the other hand, it really helps get the economy back in action, people back to work, and eliminates some fraud potential on behalf of unemployment insurance. I don't know if that answered it. There's a lot of ground to cover.
Oh, I know. There's so much. We'll see what people want to know. I still want to jump over to John Ashby, but I want to remind everybody who's on this call that this is your call to ask the experts. I want to remind you that, especially if you came in late, Natasha Fernie is with Public Health, David Kearns with OSHA, Jared Oviatt with BBSI, PEO organization. And now we're going to jump to John Ashby with, I'm going to get it wrong again. I'm going to let you introduce yourself. Tell me a little bit about your role. And what I would really love to know from you today is, how does an employer limit their liability given all of these issues that these other panelists have spoken to?
Right, thanks for having me. So my name is John Ashby. I'm an employment lawyer. I'm with a law firm called Hawley Troxell. And my role is to help employers address employee liability issues, meaning where most of the folks on this webinar today are on the side of advising employers on kind of the public health and safety issues. And believe me, I fully support all that and really appreciate these folks. I help companies when they have either employees who raise concerns, or sometimes when you have an employee who makes a complaint with the Department of Labor or OSHA or one of the various agencies. And so that's when I get involved and get to work with these good folks here. And I think one of the big issues that employers are really facing now is, or they're asking, how do we avoid liability? Just like you said, just like you asked, Ruth, how do we avoid liability when we bring employees back? And I think there's a couple of big key issues that I think employers should be thinking about. The first issue in my mind is that the way you avoid liability is to follow the orders that are out there. David and Natasha both talked about the CDC guidance. Frankly, the best way you can avoid liability from an employer's perspective is to follow all that guidance, right? That's sometimes easier said than done, and that's the first rule, is you want to follow that guidance. The second way that I think employers are best positioned to avoid legal liability is to have a plan in place for when they come back to work. So as you're bringing employees back to work, an employer, regardless of the size, should have a written plan where they set out what they are doing to keep employees safe. The reason you do that, there's a couple reasons to do that. One, you're communicating to your employees what you're doing to protect them. It also puts you in a much stronger position in the event that you get a complaint related to OSHA or the Department of Labor or an employee termination complaint, that you can show that agency the plan that you have in place and what you're trying to do. It puts you in a much, much better position. The other big issue that I think employers should be doing, or the other big thing that I think employers should be doing to avoid liability, is to make sure they have their plans and procedures in place for what you do in the event when you have employees who are sick. And any private business, regardless of size, regardless of the number of your employees, you are bound by this new act that's come down recently, this Families First Coronavirus Response Act, which says that under certain circumstances, employers are required to provide emergency paid sick leave to employees who become sick, whether they've tested positive for COVID-19 or not, but rather just when they have symptoms, and potentially provide leave to employees who need to take time off work because they're employees who need to take time off work because they have kids who are out of school or out of their daycare providers. And I think it's really important that every company have a policy in place explaining what they're going to do with those employees, so that employees know how to request that leave, and so that you as the employer know what to do when those employees request that leave. And I think if you take those steps, you're going to be in a much better position to avoid legal liability in the event of employee claims.
Thank you, John. That's great. This is a great jumping off point. And I want to let our participants know the Q&A box down at the bottom of your Zoom screen is where you can ask any questions. And even though we started a little late, I'm going to give up the floor now, Will. How are we doing on time?
We started a little bit late, so we have some time. So we have some good questions in here, and we can just jump right in. Okay, so first question here is it necessary or possibly wise to do an overnight surface clean, such as fog or thoroughly wet clean, in addition to our daily cleaning practices? So I'm not exactly sure who should answer that question, but it's how much cleaning is advisable? Maybe Natasha.
Yes, I think this is mine. So as long as you follow all the necessary guidelines, they're available out there for you, as long as you carefully follow your own protocol for cleaning and sanitizing, and also clean and sanitize your workplace at the end of the day, I do not think that you need to do any additional steps or take any additional measures overnight. However, I would advise that you ensure a proper ventilation in your facility. So the more outdoor air you allow in, the better. So if you can increase that ventilation overnight, air the place out, that'll be great.
Great. Okay. Next question is, what documentation might be advised regarding COVID-19 pre-screening, surveys, and things like that? So I think, should there be a policy in place? Should everyone be pre-screening folks when they come in? So just in general, what kind of documentation should these business owners be thinking about? And I'm thinking maybe this is John or Jared might have good insights on this.
Yeah, I'll jump in and speak to that. First of all, I think it is completely up to the employer what employee screening mechanisms you're going to put in place. You see a lot of larger companies do temperature screenings as employees come in. You can do those. I think most small employers, I think fewer small employers are, but now that those infrared temperature devices are becoming very common, it's actually a pretty easy thing to do. So you certainly can take temperatures of employees as they come in. You can provide employees with a survey to fill out as they come back to work, where they're basically required to identify whether they have experienced COVID-19 symptoms or if they have tested positive for COVID-19. You can survey your employees about that, including asking them whether they have individuals in their houses who have people who live with them who have experienced those symptoms. I actually think that's a good step that employers should take. The place where you have some legal risk there is as far as employee confidentiality, as far as if you have employees who disclose that they've either tested positive or have symptoms, you shouldn't be out there sharing that information with their coworkers. It should be kept confidential. And I think the issue that creates is the issue of who's going to be the person taking temperatures. I actually think, like bigger companies, like in my office, we actually have I think it's a CNA who's downstairs taking everyone's temperatures as they come in. That's probably the best practice. I understand that with small employers, that's not a very realistic thing to do. And I think as long as you keep that information confidential, you're in a pretty good position legally.
Jared, any additional insights from you on that?
He covered that one really well. We're always concerned about making specific recommendations because every situation is unique. However, where they cross over into more critical industries, we look in the direction that would make OSHA a lot happier in terms of, you're talking about food processing, a lot of people where there's been a history of a lot of outbreaks and contamination. We really recommend more stringent pre-testing protocols. We have some clients where we've instituted a random protocol. We just take a random sampling, and some where they test every employee who walked through the door from the senior director level all the way down to a part-time temporary individual. Unique to the circumstances, and it goes back to providing a safe work environment for the employees.
So I just want a quick follow-up on this for both of you gentlemen. So one, there's two sides to this. One is like, what are the right things to do in order to keep my employees and myself, lower the risk of the pandemic spreading to my place of business. The other is, how do I reduce my liability if someone does get sick? So how much is enough? So a business owner can feel like, the essence of this question is, I'd like to reduce my liability risk, right? So how much is enough for an employer to reduce or eliminate the risk that they are liable for something that would happen inside their place of business? John, I'm going to kick it over to you since you're the attorney.
As far as liability, the real answer there is that the more you do, the less liability risk you're going to have, right? That's the easiest way to answer that. And what is going to be enough for your business, like Jared said, depends on what you are. A meatpacking plant's going to have to do a lot more than a small office where everybody's sitting in separate offices. It's just going to depend on your circumstances. But the more you do, the better you're going to be from a liability perspective. There is no legal requirement that you take any particular step. Rather, what we're telling people they should do is look at your business, look at what level of risk you have, and take appropriate steps based on your business. I tend to think that as long, especially for a lot of you that are small business owners, probably the most important step is addressing employees who actually experience symptoms. That's probably the main step. That's probably the most important one, in that if you allow employees to work while they're sick, that's probably the best or the worst way that you can expose yourself to kind of that broader scale of liability. So I would say minimum, that's what you should be doing. And then above and beyond that, if you have the means to do temperature testing or surveys, I think you should.
I want to add two things on that as well, and I'm glad that you brought up that liability piece. A lot of the questions now are coming about workers' compensation. Am I liable for a workers' compensation claim if one of my employees tests positive for COVID? And right now it's a little bit of a fuzzy answer, but there's a couple things to fall back on. The CARES Act has mandated for small employers that they pay sick leave for people who have either experiencing COVID or suspect that they're experiencing COVID, or they are a caretaker of someone experiencing COVID. So that is the first line of defense in terms of pull them out of the workplace quickly, don't expose the rest of the team, and take advantage of the benefits that the CARES Act have extended in terms of paid sick leave and extending the FMLA benefits to those individuals. So far, there has not been a positive claim, I guess, at least in the state of Idaho. There have been claims submitted, and you can't tell somebody not to submit a workers' comp claim. However, they've all been denied so far. The NCCI has designated that illnesses not specific to us, like a healthcare worker in a contagious diseases facility, even contamination from an illness during the work hours does not constitute grounds for a workers' comp claim. They qualify that with a maybe, in that some geographies, New York, where the population density is just extreme, and there's a lot greater incidence of transmission, and specific categories of workers, first responders, healthcare workers, in-home healthcare providers for those people at risk. There could
looks like we're having Jared, we're having a little bit of an audio issue here. Your microphone's just gotten fuzzy. So let's just.
Well, Will, can I just turn this one question and just put one nuance on it for these gentlemen, and hopefully Jared's mic will clear up here. What about customer side? Is there liability customer side? If a customer comes into your premises and contracts COVID-19, is there a liability issue there?
I would say there is some potential liability, but I actually think that is not the focus that the company should have. The company should be focused on the safety issue. I actually think it's going to be very, very hard for a customer to bring a legal complaint against a company based on claiming that they contracted COVID-19. I just think it's going to be extremely hard for them to prove that. Some companies are taking steps like having customers sign a waiver form, things like that. I think for most businesses out there, there's not going to be any real reason to do that. Because the liability is small, and you putting a form out there in front of those customers, if anything, is probably just going to turn those customers away. I think there may be a few businesses where the risk is higher, perhaps in like the entertainment industry, if you're running a trampoline jump house where you got a bunch of people in there. Those types of businesses, I do think I'm seeing more businesses require customers to sign those liability forms. I actually tend to think that they don't really help you. So I think if you focus on the safety side more than kind of the legal risk side, I think you're better off. And I don't think your focus should be on being concerned about lawsuits from your customers.
Great. Here's a question related to that from one of our attendees. I work for an event center. What would happen if a customer came into the facility, later tests positive for COVID, and then they give a contact list, and this event center is on the list? What would they need to do at that point? I'm not sure who is supposed to answer that question, but I want to throw it out to the group. So somebody got sick at your work, and they said, well, who have you been in contact with? And they said, well, I went to this event center. What would the owner of that event center need to do at that point? Did they just wait for someone to get in contact with them? What actions do they need to take? Natasha, you unmute yourself.
I'm going to try to answer this. So this will depend on how close that contact was. So, and contact tracers, once they get a list and talk to a positive case person, they will determine who on that list was the closest contact. So,
is the business responsible? So like if it's a business that has customers that are coming in and out on a regular basis, like an event center, would the business be responsible for providing a list and contact information of their customers to the tracers?
Not necessarily. It depends. So if this is an event center and let's say you have dozens of people coming in every day, it will be very hard to establish that link. What contacts the customer had with what people and when. I don't think that'll be actually possible.
Does the business have responsibility to message all of the people who may have been in and out of that event that day that there was a positive COVID testing and they should contact a tracer or get screened?
Possibly.
Okay. Okay. So here's a question about
epidemiology. Yeah.
I know that none of these are like there's lots of nuances to each of these scenarios.
Right, there are a lot of epidemiology details and nuances that are taken into place.
But a business should potentially be not surprised if they come in and they say who is in your place of business that day that had contact, and send a message to people letting them know, so maybe they can self-disclose. Is that something that could happen just so they're ready for it, or is that not likely at all?
Yes, it could happen if your local public health department and epidemiology team determines that there was a legit public safety risks, public health risks. Yes, there will be. You'll have to disclose certain aspects.
Great. Okay. Okay. The next question, I believe this might be for David. If an employer is the employer responsible for providing masks and hand sanitizers, does it matter if the employer requires or doesn't require their use?
That's another good challenging one. And after I give my best stab, maybe I'll defer to a couple of the other employment lawyers here on the call. Basically, masks, face masks, loose-fitting masks such as surgical masks. I'm glad that people are developing a good understanding on this, that these are not considered personal protective equipment and that they are designed and have long been designed to basically prevent the wearer from getting somebody else sick. You see those when you go into a surgery because you don't want your surgeon breathing their aerosols into your open viscera or whatever it may be. So masks is a challenging one, and I'll let maybe some of our public health folks talk about this a little bit as well too. But it does appear that there is some objective information out there that basically shows that wearing masks reduces the amount of aerosol and therefore the amount of potential viral particles that the wearer is using. These are not things that OSHA requires. However, we're always going to be going back to asking employers what they're doing and if they're complying with the most current and up-to-date guidance out there, which includes face masks and sanitizers. Now, is OSHA going to come to your work site and shut you down because you don't have? By the way, that's a myth. OSHA doesn't shut down work sites. Are we going to come to your work site and issue a citation because you didn't provide sanitizers? That's probably highly unlikely because we don't have a specific rule or requirement for it. But in situations like this, a lot of the times I like to say OSHA is not the bad guy here. What you should be more concerned about is doing the right thing for your workers, your customers. And if that's not enough to motivate you, then talk to the lawyers about your liability here.
Great, thanks, David. Anybody else want to jump in on that? He handled it okay. Okay,
Yeah,
great.
that's exactly right.
Okay. Okay, so here's a related question. I operate a cabinet/mill shop, milling hardwoods. We currently operate with approved face mask, face shields as SOP. I'm hoping somebody knows what that acronym means. Are there any further items we've missed? We did add hand sanitation to the protocol. So they operate with approved face masks and face shields. And this is a cabinet shop. Do they need to add anything else to the list? I'm thinking maybe this is David or Natasha.
I'll give it the first stab and then I'll shut up and let you guys take a crack at it. SOP is standard operating procedure, I imagine is what he's talking about. And I'm not sure what he means regarding an approved face mask, because technical respiratory protection are NIOSH approved. An N95 respirator, by the way, is an approved respirator that's designed to protect folks, the wearer, from exposure. So if they're wearing an N95 respirator, that might be a little excessive in a cabinet shop. Another little nuanced thing with that is a lot of them have an exhalation valve on the outside of it. So sometimes you're damned if you do, you're damned if you don't, or whatever saying you want to use, the road to hell's paved with good intentions. An exhalation valve basically will allow the wearer to basically expel aerosols as well too. So depending on what you're kind of trying to do, there's a little bit of a trade-off here. I think to answer that person's question, I think they're well on their way. They're doing what John and Jared talked about, which is having some procedures in place, and they're actually thinking about it. But they might benefit a little bit from taking a look at one of the different websites to see if there's some other areas that they might be able to do a little bit more or a little bit better to basically cover all their bases.
Great. Anybody else want to jump in? Okay, I'll take your silence as a no. The next question here is, I have customers in other states that need this person's company to travel to their facility to help with problems. One of my employees is concerned about travel and staying safe. Can he refuse traveling based on this concern? I think that the biggest worry for this person might be staying in hotels, but if you're a business, your primary business is traveling to help other facilities, and can your employees refuse to work legally without repercussions because of fear of COVID? I'm thinking Jared or John on this one.
I want to defer to John on this because the word can legally refuse. A couple things just from an employer standpoint is if it was part of their prior job responsibilities and practices to travel regularly to service clients, hotels, airplanes, rental cars, that sort of things, and you have established procedures in place and they are following the protocols during travel, and that is now the expectation, and you're allowed to do that by the respective states, that would be a conversation to have in terms of, are they willing to perform their basic job functions? And that may be grounds for either reassignment, termination, or corrective action to be taken as an employer, because that were the grounds under which they were hired, and you were taking every necessary precaution to ensure their safety. So I don't think they have a legal ground to refuse reasonable work with reasonable precautions. That would be the counsel that we would give. I'd love to hear John provide some more clarity around that.
That's exactly right. So one, I would say an employee can refuse. They can always refuse, and they can say, I'm not going to do this. But then the issue becomes, what can the employer do if you can either require them to or essentially terminate their employment for refusing. I actually caution against terminating their employment And the reason for that is it can create some legal risk as far as that employee claiming that they were a whistleblower and they were raising a concern. And frankly, the classic example would be they would say they were raising an OSHA protected concern and that you fired them for it. So I would advise against that. If you do fire them, there's a pretty good chance they may run off to the OSHA office and file an OSHA retaliation complaint. I think the better approach generally is to try to address their concern. And if they're not satisfied and are not willing to do that job, then they likely would end up going on to an unpaid leave status, is probably the most conservative, appropriate step to take. I do think anytime you have an employee who's expressing a concern about the safety, you need to address that. You need to realize that basically is, whether they're using the words OSHA or all that kind of stuff, they're raising a safety concern, and you need to address it in an appropriate way.
Okay.
Will, I would like to honor everybody's time here. We are at the top of the hour. If anybody needs to leave, I would also love to get another 10 minutes out of you to finish these questions because we got a little bit of a late start. If anybody needs to leave, I absolutely want to honor everybody's time, whether you're a participant or a panelist. And would anybody choose to give us another 10 minutes?
Well, we don't have a poll so they can vote on it. So what I recommend is if those
all our panelists said yes.
Oh, great. So we started about 6 or 7 minutes late. So I'm going to push for another just few minutes to answer. There's about 3 questions that are new that I want to get to before we end today. So for anybody else needs to jump off, including our panelists, totally understand. Thank you for your time. Okay, so here's and thanks for jumping in there, Ruth. Here's the next question. I'm a new employee in a public service job. I am the only one who wears a mask to our meetings. I don't want to make waves because I'm a new employee. There's a lax enforcement on masks and my supervisor isn't wearing one. What should I do? That's the question. I don't know who to direct this to. This is everybody. Everybody gets a chance at this one.
I'll open the ball and be brief. My guidance would be if an employer or employee came and talked to us about that is first I want to know what the expectation was overall for the company. And if there was any clear direction given in terms of guidelines on reopening, I would start there and want to find out what that landscape looked like.
Okay, anybody else?
Oh, similar to how I answered Ruth's question early on in the presentation, that if that employee were to contact us, they could file a complaint or concern, and we would address that anonymously, and we would basically reach out to the employer, provide them a bunch of resources, pose our concerns about how they're protecting workers in the workplace, and see how they respond. And sometimes that is sufficient to get them to take things a little bit more seriously. But oh boy, when it comes to wearing masks, all you have to do is go out to a grocery store or anywhere out in public, and you'll see that there is a whole lot of differences in opinions on that sort of thing. But we're happy to talk to anybody that has any concerns about that in the workplace.
Okay, great. I have 2 more very specific questions, and they might just fit into broader categories, but I think it's worth asking these specific questions anyway. So one is it reasonable to ask the landlord to hire the carpets to be cleaned and have them pay for it? I rent an office building with a few other tenants. None of us are willing to pay to clean the carpet. I'm guessing the carpet cleaning is related to COVID-19. Is that, can you request that is that a reasonable thing to request? Because due to COVID-19, we have carpets, we think they should be sanitized and the landlord is responsible for that, or is that something that the business is responsible for that's renting that? Anybody?
Well, I think that's a tough one. I mean, really the answer to that's gonna be in your lease agreement, perhaps. I think it's purely a matter of negotiation between the landlord and the tenant as to who's going to be responsible for cleaning and carpet, all of that. But I do think it is the employer's responsibility to create a safe work environment. And so if whatever you have to do to make it safe is what you have to do, who's going to pay for it is a matter of negotiation between the tenant and the landlord.
Okay, great.
I was just going to add to that. I mean, Natasha, you're the public health person, but I have not seen any guidance out there that talks about just regular cleaning of of carpets, or whether or not that is, really much of a significant source of concern. And I know there's a whole lot of data coming out every day, thousands of studies and publications that are coming out, but I don't believe that is known to be really much of a concern as far as COVID transmission.
Got about 50.
Right, David, and you are correct. Carpets would not present a significant concern. I did, however, see mentioning of cleaning the soft surfaces in one of the CDC's guidelines. So it's out there. They're mentioned.
Okay. So maybe check the lease, because you might have carpet cleaning in there anyway. It might be good to have. Okay, and there's just two more questions here. Hopefully we can answer them quickly. As our here we go. All of our work is done outdoors. We have implemented a same equipment tool for each employee, no exchanging. So there's that protocol. Plus clean, disinfect the equipment daily. So if they've implemented that. We are struggling with travel. Some of the job sites may be 6 to 8 hours away. How do we structure a plan with travel? We have added more vehicles with less employees in each, but are struggling with what more can be done. Anybody want to take a stab at that one? David, Jared, John, Natasha?
Well, I'm thinking there should be a protocol in place or standard operating procedure for cleaning and sanitizing the vehicle after each use as well.
Okay.
By the employees. And another thing too, different counties in the state of Idaho also have different levels of transmission at this time. So that needs to be taken into account.
Okay, great. So sanitizing. Great. Okay, so last question that we can get to today is, as our economy is opening up, some businesses are bringing more staff back to work, but at a different wage level, oftentimes lower than what they were originally paid. Is the employer given the latitude based on the economic conditions, or are they in violation of some directive or law if they bring those employees back at a lower wage? I'm going to start with John on this one.
Yeah, it is completely up to the employer what you're going to pay your employees. And so if they were making whatever amount before when the company shut down, if you decide to bring them back at a different wage, you are allowed and entitled to do that unless you have a contract with that employee. So if you have like an employment contract that provides for a particular wage or a particular salary, then you're bound by that contract. But if it's an at-will employee, you can change their rate. You see some companies are increasing rates, right? Like the grocery stores, a lot of them have been increasing rates. But some companies are decreasing employee pay because of the economic circumstances, and you can do that.
Okay. Are there any other things like protected class status or anything that they need to take into account if they're going to do that?
As long as it's across the board and equal, I don't think you need to worry about that. Where you would have concerns is if you lowered the pay of your older employees or your African-American employees and didn't lower the other ones. That's where you could get in trouble. But as long as you're doing a pay change that is equal and non-discriminatory, I don't think that's a concern for you.
Okay.
The only thing I would add is that if you're concerned about the PPP loan, if you've received that, then there are specific requirements about your forgiveness. If you reduce the wages of your employees that you bring back, it will reduce the amount that you have forgivable. It's in direct proportion essentially to either the head count or the wage reduction.
Great. Okay. Well, we are now at 3:10. Thank you so much to our panel for all of this excellent information and for answering all of these questions live and really digging into the specifics of each of these questions. Really, really helpful information. And for all of those who are watching, we have recorded this. We'll send out a link so you can rewatch it. And if you kind of bopped in and out, you'll get a chance to watch the pieces that you missed. I do want to say, please head over to idahospdc.org/COVID-19 resources. We have a lot of resources there for businesses. And we also have many more training webinars for the important changes that are happening and how that affects businesses. So please stay tuned into our website for the latest training offerings. And we're doing trainings like this. We have partnered with the Department of Labor for pandemic unemployment insurance, with the governor's office, with Idaho cash grants, with SBA. So we're constantly bringing in the best experts from around the state and even from the nation to give this information directly to Idaho businesses. So pay attention there. And I want to thank Ruth for taking the time to really dig into to understanding what businesses need to know the most, and for facilitating this really great Q&A. Thanks to you, Ruth. For everyone who attended this, thank you for spending the time, and hang in there. We'll all be out there visiting each other's businesses soon with masks and hand sanitizers and surveys and policies, but that is the new normal. So at least we are able to return and find out what the new normal is going to be. So thanks again, and we'll see you next time.